Your complete blood count is one of the most frequently done blood tests in the medical field. Doctors use it to help diagnose many different conditions. And if your test results come back normal, that is actually a very good thing. However, sometimes there can be some subtle hints or clues that can show up on your CBC that you may want to pay attention to. And in this video, we're going to talk about one in particular that doctors do and seem to talk about very much. But it's something that I think you should know about, especially if you have high red blood cells. Now, I know that probably doesn't sound like a big deal because we need red blood cells, right? Well, yes, but too many of them can cause all sorts of problems, so let's dive into it. High red blood cells. As with any condition, always make sure to speak with your doctor before making any changes to your diet or lifestyle. The medical term for high red blood cells is called polycythemia. The word polycythemia means many, many blood cells. And the reason why you would have an elevated red blood cell count is because the bone marrow, which is the spongy tissue inside of our bones, produces these cells. And so when the body thinks it needs more red blood cells, the bone marrow kicks into gear and starts pumping them out. There are many different reasons why your body might start making too many red blood cells. And that's where things get interesting. But first, how do you know if you have high red blood cells? Well, you don't really feel anything. There's no symptom that goes along with this. The only way to find out is through a blood test, specifically a complete blood count, which checks both the red blood cells and white blood cells. And the results will come back with a number of red blood cells. For men, anything over 5.4 million is considered high. For women, anything over 4.8 million is considered high. Now keep in mind that this number fluctuates throughout the day, and it can change depending on many different factors such as age, altitude, pregnancy, smoking, among many others. That being said, if it comes back consistently high over multiple tests, then it's definitely something you want to pay attention to, because it can lead to other health problems down the road. One of the biggest problems with too many red blood cells is that they become sticky and they tend to clump together, which can slow or even block the flow of blood. This can lead to many other problems such as high blood pressure, stroke, heart attack, blood clots, among many others. Also, the more red blood cells, the thicker the blood becomes. And this makes it harder for the heart to pump the blood through the body, leading to the heart working harder and potentially becoming bigger over time. We call this cardiac hypertrophy. This can lead to heart failure, where the heart loses its ability to pump effectively. So what causes the body to start producing too many red blood cells? One of the most common causes of high red blood cells is having too much iron in the body. Now, I've talked about this in other videos, but iron is an essential mineral that our bodies need in order to transport oxygen throughout the body. However, just like with everything else in life, too much of it can become toxic. When you consume iron-rich foods, it gets stored in the organs, and over time it can build up, and it can lead to a condition called iron overload. This is extremely dangerous and can cause all sorts of problems, including damaging the liver, pancreas, heart, and even the pituitary gland. The main treatment for this is to remove the excess iron through a process called phlebotomy. In other words, removing blood. Question is, how do you get too much iron in the body? Well, our bodies actually get most of their iron from the liver. Every time that you eat meat, it breaks down the old red blood cells and recycles the iron. So when the body has too much iron, it becomes trapped and it cannot be recycled. This can happen when someone has a genetic condition called hereditary hemochromatosis. It also happens when people abuse alcohol because alcohol damages the liver, and it interferes with the liver's ability to get rid of iron. Too much iron can also come from taking iron supplements for too long. Even though iron is an essential nutrient, it does have a dark side, and you definitely don't want to mess with it. Another condition that can cause high red blood cells is called erythropoietin-producing hepatocellular carcinoma. Wait, don't let that name fool you. I wouldn't blame you if you didn't know what it was. Basically, the name refers to a rare type of liver cancer that produces too much of this hormone called erythropoietin. Erythropoietin is basically like a growth hormone for red blood cells. So if the body has too much of this hormone floating around, guess what happens? You got it. The bone marrow starts pumping out too many red blood cells. The good news is that this is a very rare condition, and it only accounts for 1% of all liver cancers. But the bad news is that it has a very poor prognosis, meaning it doesn't usually end well. Okay, Moving on. Another condition that can cause high red blood cells is something called the myeloproliferative neoplasms. This is basically a group of disorders that affect the bone marrow. These conditions cause the bone marrow to make too many blood cells. Not just red blood cells, but white blood cells and platelets as well. These conditions are usually slow-growing, but they can become problematic when they interfere with the normal function of the blood. These conditions often require treatment with chemotherapy. Luckily, these conditions are also quite rare. Next, we have polycythemia vera. This is a condition where the body produces too many red blood cells due to a problem with the bone marrow. But unlike the last few conditions that we've talked about, this one is actually more common, and it affects about 300,000 Americans. Fortunately, there is a cure for this condition, but unfortunately, less than half of all patients are cured. People with polycythemia vera have an increased risk of things like high blood pressure, stroke, heart attack, and blood clots. And these people are at least twice as likely to develop some sort of blood cancer later in life. Another condition that can cause high red blood cells is something called secondary polycythemia. This occurs when the kidneys produce too much erythropoietin, which again is the hormone that controls the production of red blood cells. The most common cause of this is someone is living with chronic kidney disease and the kidney is starting to shut down. Having too much erythropoietin can also be caused by someone abusing the performance-enhancing drug EPO. Also, people who live at higher altitudes tend to have higher levels of red blood cells because the air is thinner and it has less oxygen. And as a response to this, the body tries to compensate by making more red blood cells. This is not really a problem unless the person decides to move to a lower altitude, and now their body is stuck trying to compensate for too many red blood cells. There are several other conditions that I'm not going to go into detail that can also cause high red blood cells. They include congenital, erythropoietic, porphyria, homozygous, C-trait, glucose, 6-phosphate, dehydrogenase deficiency, and hemoglobin C disease. Bottom line, the point of this video is that when someone has high red blood cells, that could be a sign of something more serious going on in the body. Remember, high red blood cells themselves are not a disease, but they can lead to other problems down the road. Now you might be wondering, how do you treat high red blood cells? Well, that depends on what's causing it. If it's due to too much iron, then they will remove the excess iron through regular bloodlettings. Polycythemia vera is treated with chemotherapy. And secondary polycythemia, which is caused by chronic kidney disease, has no real treatment. The best course of action is to prevent it from happening in the first place. And what is the best way to do that? Through regular checkups, have your blood pressure checked, eat healthy, and exercise. Make sure to get your complete blood count checked every now and then. And if you have a family history of blood disorders, make sure to get checked more often. I hope you found this video useful. Please like and share it with your friends and family. And as always, stay happy and healthy.